Pickpockets drop their loot before the bobbies come sniffing. Feeling bold? Become a costermonger swindler, selling bruised fruit or watered-down milk from a rickety cart, disappearing before complaints catch up. Or try your hand at forgery, card tricks, or the always popular three-card Monte, a fast-talking scam with a faster getaway. And if you've really got guts? There's always burglary. Break into a warehouse, a merchant's shop, or, if you're desperate, a church. You might find something valuable. You might also find a constable with a billy club and no bedtime. The police force exists, but they're underpaid, undermanned, and often 2 steps behind. Plus, you can bribe the right officer if you know the system. And let's face it, you probably do. Crime syndicates in London were shockingly organised. Some had territories, code words, and full recruitment pipelines. Then there's the resurrection men, body snatchers who dig up fresh graves to sell corpses to medical schools. It's gruesome. It's illegal. It pays better than sewing buttons. Of course, the consequences are real. Get caught, and you could be flogged, branded, jailed, or worse, transported to a penal colony. But if the alternative is starving on a cold street, well, risk has a certain appeal. Because in Victorian London, morality comes second to hunger. Crime isn't the opposite of work. It is work. And for many, it's the only job that hires. Let's say you've caught something. A cough, a fever. Maybe your leg's been run over by a delivery cart. Time to see a doctor. Good luck. Because in Victorian London, medicine is less healing science and more creative improvisation with sharp metal. Doctors are out there, sure. Some even wear coats. But unless you're wealthy, your first stop isn't a physician. It's a chemist, where the cure for every ailment is a small bottle of laudanum, opium in liquid form, ideal for anything from a sore throat to existential dread. It won't cure you, but you'll stop caring. Can't afford a chemist? Maybe there's a barber surgeon down the road. Yes, a man who cuts hair and also amputates legs. If your wound is infected, he'll saw it off. No anaesthesia, no antiseptic, just a stick to bite and a bucket to scream into. And don't even think about hospitals. They're overcrowded, poorly ventilated, and smell like old bandages and lost hope. The instruments aren't sterilised. Surgeons wipe their hands on aprons between patients. Germ theory exists, but many still think disease is caused by bad air and moral failure. If you survive the treatment, infection may finish the job. A splinter